Hello everyone, welcome to the AT7, also AT10 and 11 Bronze Medallion Assessment overview of the two key ones that people do struggle with, and that is the board rescue scenario and the spinal injury management scenario as well. We're going to go through each one and compare them to the marking criteria so we have an understanding of what's expected of you as a candidate. So on the day, you're feeling a little bit more confident. Of course, things do change and there are slight variations, but the underlying principles remain the same. Let's start with AT7. So firstly, there will be a lifesaver called Lifesaver 1. Generally, a victim will be another candidate that will be in the water, generally past the break zone. And you also have a radio operator. Depending on the number of candidates, there will be also Lifesaver 2 and 3 that will assist with the extrication of the patient once you return back to the shoreline. Now, in this scenario, Lifesaver 1 will be doing the rescue, so it's really important that the candidate understands surfing conditions, has a good understanding of the tides, has read through the surf conditions prior to arriving on the beach for assessment, so knows when high tide and low tide is, has identified the rips, has identified the sets and lulls, so that when they enter the water, they can safely negotiate and get through those sets and not lose the board. Because obviously the main goal is to get to your patient, so please do not lose that board if you can. So in this assessment, 7.2 per the assessment criteria, you will identify the victim, so that will be Lifesaver 1, select the appropriate rescue equipment, which will be a board in this case, and respond to signals from shore should you need to be directed by the radio operator, which will be assisting you to find that patient if you cannot find it in the conditions. Lifesaver 2 and 3 again will assist Lifesaver 1 once they have returned to shore, and Lifesaver 4 will be the radio operator, which will advise initially the patrol of the situation of the rescue and then SurfCom about requesting an ambulance. So Lifesaver 1 will navigate using techniques such as timing the rescue board over the whitewash of the shoreline, paddling through deeper channels such as the rip current, and using techniques such as the push-up, pop-up, and roll-over or Eskimo roll to ensure that they do not lose that board. It's always important to maintain positive momentum, so try not to slow down too much unless you are in the break zone and you need to wait for a wave that it's forming to crash before getting through. Whilst the rescue is happening, the assessor may ask the radio operator on the beach to do initial radios comms to the patrol and to advise that a rescue is underway. So in this case, we'll be using South Narrabeen Patrol as the example for the scenario. So the radio operator will use the 4 Ps to initiate that comms. So South Narrabeen Patrol, South Narrabeen Patrol, this is South Narrabeen roving over. They will reply with South Narrabeen roving, this is South Narrabeen Patrol, go ahead, over. You will now initiate your 4 Ps. This is an example. We are 100 meters north of the surf club. We have an approx 40-year-old male swimmer in a black wetsuit, roughly 50 meters out to sea, floating face down, appears unconscious. We have sent a surf lifesaver with a board to rescue swimmer. Can we get oxygen and defib to our location, over. South Narrabeen roving, message understood, out. So once the patient has been successfully brought onto the board, using the techniques that we'll show you during the practical days, during the training course of the Bronze Medallion, once that patient is on, you will turn the board and have the patient facing towards the beach and start making your way. It is important that you do signal and request for assistance to ensure that you have Lifesaver 2 and 3 ready for you once you get to that shoreline. So you'll turn that board and you'll make your way back to shore. Now, just as you're about to reach the shoreline, before you essentially hit that sand, you will have Lifesaver 2 will enter to the right of the board to hold on to the board itself, to stop the board from floating away or hitting anyone else or your patient. Lifesaver 3 will come towards the left of the board to ensure that the patient can be successfully picked up using a 2-person carry. So I'll use, I see if I have a pen, if I have. Yeah. So again in here, so Lifesaver 1 will be at the back of the patient. Remember, this patient will be face down. You have Lifesaver 2 holding the straps of the board, and Lifesaver 3 will make their way to the back of the board to carry the legs and the buttocks once you initiate the patient carry. So Lifesaver 2 has taken the board away. Lifesaver 3 will be on the legs, and Lifesaver 1 will be on the under the armpits. So prior to this, Lifesaver 1 will get off the board, get to the front of the unconscious face down patient, will grab underneath their armpits, and with the assistance of Lifesaver 3, will roll the patient onto their back in the water. Once the patient is off the board and Lifesaver 2 has taken the board away, Lifesaver 1 and 2 will do a count on 3, all ready to lift, and will lift the patient from the water above the water to initiate the carry to the shoreline. And this is covered here by rescue view board pickup on shoreline, signal assistance required, and now you are now returning the victim safely to shore. It is important that appropriate lift is done, so making sure you're really close to the patient if you're under the armpits and you're not bending over. It's important that you do good manual handling techniques. Before you go to shore, you need to make sure that the legs have been rotated so the patient is facing towards the beach, so the legs are pointed to the beach. This ensures that the person under the armpits has a direct line of sight and is able to direct everyone else on their way back to shore. Important for Lifesaver 1 and 3 to communicate to walk past the shoreline or the wet water line, and to ensure that they are pacing the patient and lowering in a safe location to north side. So if this is north and that's south, we're going to make sure that the patient is facing to the north. So once the patient's been lowered on the north side, as well as a correct manual-handed technique past the wet water line, Lifesaver 1, which is the initial person who commenced the rescue and actually retrieved the patient, will perform a primary assessment. So this is your doctor's ABCD. So you've covered the D by getting out of the surf and getting past the water line and placing the patient in a safe location. You are now checking a response by squeezing the shoulders and asking simple commands, including, can you hear me? Open your eyes if you can hear me. Squeeze my hands if you can hear me. There is no response. You then will check an airway, clear if required. So using a head tilt and jaw thrust and chin lift, and really look at that airway. So again, head tilt and chin lift. You will then check for breathing with ear over nose, cheek over mouth, head down, looking down towards the chest with a hand over the chest, looking, listening, and feeling for breathing. The assessor will then state that the patient is unconscious but is breathing. At that point, the Lifesaver 1 will place the patient into the recovery position. Once the recovery position is done, ensure that the head is tilted back and the mouth tilted slightly downwards to ensure continuous drainage of the airway, and reassess the airway as well at that point. The radio operator will then perform a second radio comms, not to South Narrabeen Patrol, but now to SurfCom, requesting an AED and ambulance. This is clearly part of the assessment criteria, so please make sure that you do request an ambulance and AED during that communications. You will request SurfCom 3 times, so SurfCom, SurfCom, SurfCom. This is South Narrabeen Patrol, over. South Narrabeen Patrol, this is SurfCom, go ahead, over. Initiate your 4Ps again with an update of the situation. We are 100 meters north of the surf club. We have a male patient approximately 40 years of age who has been retrieved from the water. The patient is unconscious and breathing. There is no bleeding. We have placed him in the recovery position and are actively monitoring. We need an ambulance over. You can also mention AED should you need to. Have you not already requested an initial comms to the patrol? SurfCom will then say South Narrabeen Patrol, message understood, ambulance being attached out. And that is your radio comms and the completion of assessment task 7 for the rescue board scenario. Let's move to spinal management scenario AT11, which also includes AT10, the rollover technique. So again, there'll be 5 in this scenario, not excluding the 6th person, which is the candidate or which is the patient. So the first responder, which is number 1, will signal assistance required. Looking through the criteria shown here. Now let's get the highlighter on. So we'll signal assistance required. Correct body positioning, protect victim from oncoming waves. Correct performance of the extended arm rollover or vice technique. You only need to demonstrate one of these in the assessment and stabilize the victim on their back. So ensuring that their backboard is appropriately positioned on that patient. So roles will be allocated prior to spinal injury. Lifesaver 1 will enter the serve zone first and will log roll the patient using the extended arm roll. And this patient will be face down in the water. Lifesaver 2 will enter second and go either side. It does not matter, but either side, ensuring that the lower body of the patient is in line with the spine by lifting the patient's butt. It is ideal in this time from Lifesaver 3, 4, and 5 that you have determined who is tallest and who is shortest, because the tallest lifesaver should be placed nearest to the head, as the majority of the beaches have an upward slope, increasing the risk of uneven movement and uneven board angle as you're returning back to shore with your patient. So here's a demonstration. So Lifesaving 1 and 2 will immediately assist in rolling the patient and stabilizing the head. Please ensure that the arms, that the biceps and triceps of the patient are squeezing the head to maintain that head neutrality and inline stabilization. Lifesaver 3, 4, and 5 will filter on either side of the patient. Now I do have numbers here, but again, 3 or 4 can carry the spine board, but generally speaking, if you are entering after 2, you generally will have the spine board, and you will be inserting the spine board opposite to the person holding the butt. Okay, so please make sure that you're not entering in the same side of the patient lifting the butt, as we run the risk of creating chaos, trying to squeeze around that patient, as well as that lifesaver. So to avoid unnecessary complications, always come opposite to the person of Lifesaver 2. Once everyone's in position, you're going to push that spine board underneath the patient. So not pushing against the patient, you're going to push it and submerge it under the patient, ensuring that the patient is correctly positioned and not dangling off that spine board. Do ensure that that spine board has the head rested on top of it and that the head has not been lifted accidentally by the Lifesaver 1 with the rollover technique, or the extended arm roll technique. When you're navigating back to shore, the principle is that the head, whoever is on the head of the patient, is maintaining inline stabilization and is watching and directing the team to go back to shore. Lifesavers 2, 3, and 4, and 5 should be looking towards the surf line every now and then to identify if a wave is coming that could potentially cause a misalignment of the spine board. And if that is the case, they will yell to Lifesaver 1 or to the team that a wave is incoming, and they will essentially say, as mentioned here, if a wave is coming, one Lifesaver, not Lifesaver 1, will initiate the lift. They will say, wave incoming, prepare to lift, and lift, wave will pass, and then the patient can be lowered again, and then you will continue making your way to the beach. Now, when you're returning to the beach, Lifesaver 1 will initiate the call to move, so no one else can move until Lifesaver 1 initiates that. They will advise that we are going to move past the wet water line, and once they reach the wet water, or past the wet water line, they're going to be the ones to initiate the stopping motion. So please never start moving or rotating the patient until Lifesaver 1 has delegated or made an instruction. So as you're walking past the wet water line, Lifesaver 1 will state stopping on 3. 1, 2, 3, stop. And then the team will stop. Lifesaver 1 will then say a command to turn the head to the north. So on 3, turn to the north. 1, 2, 3, turn. The team will turn the patient. Once the head is to the north, Lifesaver 1 will advise the team to lower on one knee first before lowering again to the ground to ensure an even lowering of the patient and a safe manual handling of that lowering technique. So on 3, we will lower on one knee. 1, 2, 3, lower. On 3, we will lower to the ground. 1, 2, 3, lower. In this position here, Lifesaver to the left of the patient. So let me get my red pen here. Here, we'll insert their hands between the arms to hold onto the neck, whilst Lifesaver's around the patient, including Lifesaver. I don't know what's going on here. So let's go back here. I skipped a part here. So Lifesaver 4 here, left of the patient, will use their hands to insert between the arms that are currently hugging the head, where Lifesaver 1 and 2 will assist by removing the arms and placing them down onto the side of the patient. From there, Lifesaver on the left side will take over the head position, so move over from where Lifesaver was to ensure a continued inline stabilization of the neck. Lifesaver 1 would then perform a primary survey, reassessing the airway and breathing. And the assessor will say that the patient is unconscious but breathing. As a team, the patient would then be log rolled with Lifesaver on head directing when to roll. Again, doing a countdown. So on 3, we're going to roll, ensuring that the patient is logged together as a team. Once the patient is log rolled, you will remove the board from the patient. It is important that when you do the log roll, you are not log rolling the spine board itself. You're just log rolling the patient. And you also check in the back once you do the log roll. When the log roll is done, you will then reassess the patient. And then on a count of 3, you will log roll the patient onto their back again. And that will be the conclusion of the assessment. Thank you. Hopefully all goes well on your assessments. Thanks, guys.